Hi, everyone. On today's podcast, we're going to talk with EBB Childbirth Class graduates Paige Wener and Kevin Booth about navigating a surprise preeclampsia diagnosis, a 54-hour-long induction, and finding peace with a birth that looked very different than originally planned. Hi, everyone, and welcome to today's episode of the Evidence-Based Birth Podcast. Today, I'm so excited to welcome our guests to the podcast who are here to share their birth story, Paige Wener and Kevin Booth. Paige and Kevin live in rural Vermont with their son, Ira, and their dog, Athena. Kevin is a scientific instrument technician at their local college, and Paige runs a small-scale organic vegetable farm. They enjoy reading, listening to podcasts, cooking, and working outside. They are both graduates of the EBB Childbirth Class with Lucy Paradiso, and today they are here to share their birth story. Paige and Kevin, welcome to the Evidence-Based Birth Podcast.
Thank you for having us.
Thank you.
Yeah, it's exciting.
So could you tell me a little bit about how you got connected with EBB and eventually with the Childbirth Class?
Yeah, I was an avid listener of the podcast for 2 years before we got pregnant. I like to really prepare for things. So I found your podcast through Lily Nichols' work, actually, because I had read her book, A Real Food for Pregnancy, and listened to a lot of podcasts that she was on. So I got clued into your podcast and started listening. And then from there, I think I knew that if I was going to take a childbirth class, which is always a good idea, I would do it through EBB. And you overheard a lot of the podcast.
Yeah. I'm not somebody who presses play, but I hear a lot. Yeah.
Yeah. So that's how we kind of found it. And then Lucy did an online only class in the Northeast. So we were on there with a lot of other people in the Northeast, but Vermont is very rural. So it's hard to find any in-person things, really.
Right. And when you were listening to the podcast for those 2 years before you had a baby, what were some of the topics you were most interested in learning about? Since it sounds like you really like educating yourself.
Yeah, I like to kind of become a sponge and absorb things. So it was a lot of that, a lot of osmosis. I love the birth stories and hearing everybody's. I think it's really helpful. I think the birth stories are helpful because things happen and you get to hear how people respond to them and how they've been prepared for them or not. And just lots of different experiences too. And then we were really into evidence too. So all of your features on very specific, we listened to a lot of the really research-backed stuff, which was extremely helpful because it's good to be prepared. So we wanted to be really prepared. So a lot of all the mix of things just in preparation.
And could you both kind of tell me a little bit from each of your perspectives what it was like taking the class with Lucy?
I knew a lot of the things going in because of listening to the podcast. And for me, it was really nice to have, it was a practice for both of us to be together and prepare. So that was really good. That experience of being together and learning things was really great. The class was extremely thorough. Lucy was really nice. And it was nice to connect with other couples who were expecting kind of in the same time as us and hear about their worries and their concerns and everything. So, yeah.
Yeah, I'd say the doing that as a couple was really important. It's and doing something as a unit and being on a call like this kind of, but with a class acting as a unit, really important to get ready for that. Because again, we had been doing a lot of reading, but it really sparked a lot of conversations about specific, if this, then what, kind of, because I think that's the way I think. So the class really worked for me in terms of thinking through things, that kind of flow chart sort of style of thinking. That's the part that I really absorbed from it.
Not having a rigid plan, but more, like you said, if this, then that, here's some options we would have.
Yeah. And I think know what you're gonna do given certain information ahead of time. If I ask this question and I get this information back, this is the way we would prefer to go, but we also know if we get different information back, we can go this way. So you can't plan for everything, but you can do it. You can do a lot of planning.
You can learn as much as you can. And was there anything in particular for either of you that you didn't know about birth going in that you learned in the class or through the course of educating yourself about pregnancy and birth that kind of wowed you or was like, wow, I'm learning something really important right now?
Oh, yes. One thing, because Lucy's a doula, so she also has her own personal experience that she brings to the table from helping clients. And something that actually ended up helping us and that I was a little bit oh, that's really interesting, was she recounted having a client who needed an induction because of high blood pressure. And she was able to ask to get a sleeping medication and spend the night in the hospital before starting her induction. And she was just able to relax a lot more and get a good night's sleep and then go forward through the induction. So asking for kind of what you, that level of asking for what you really needed at the moment in the face of, something really surprising or you weren't prepared for it was really important. So that was a really nice example of advocating, a specific one that I took to heart.
For me, one of the most surprising was the way that medical professionals kind of frame decisions, whether they are, and you colloquially hear people come out of situations like a birth where they say things like the doctors made us X, Y, or Z.
Or they let us.
Or those kind of things. And just the class really kind of illuminated how that kind of framing it's not really right. You are the decision maker in that situation when you're the one who's the patient is the decision maker and you have to make those decisions in conjunction with your doctors and nurses. But I think that was something that the class really illuminated, because I guess I would have kind of believed more the hospital forces you to do that X, Y, or Z. But it's
you have to do things.
Yeah, but they don't strap you down. I mean, normally that would be a problem. So yeah, that was really informative to me.
Yeah, they're not the legal authority in the room. Yeah, which is helpful.
So it sounds like self-advocacy and some communication techniques were helpful for you. And that can translate to much, far beyond birth. So that's great that you had that experience together. So what kind of birth then were you planning, as you were taking the childbirth class?
I really wanted a water birth. Our birth center was amazing. So we have a small rural hospital, which has a hospital attached birth center, but it's separate. You don't go to triage when you get there. You just go right to the birth center. So all my prenatals were in this one office building, and the birth center is just a little sidewalk walk away. So they are amazing. We'll probably get into all the things they offer, but they did have an aqua dua tub, the big tub. So I really wanted to do a water birth. That's kind of what I was planning. And pregnancy was really easy for me. We didn't have complications until the end. So it seemed like that was going to be very possible. I stayed really active. I was farming all the way through. And I had some dizziness spells.
And
morning sickness was rough. And I vomited through the second trimester and it finally ended. But going forward, it seemed as though we would be able to have a very low intervention. We wanted a low intervention birth.
Mm-hmm.
And we wrote a birth plan, but a lot of things were covered by our birth center. So they have mini fridges in the room. So we knew we were going to be able to eat and drink, or we would be able to eat and drink and everything. They have tubs and showers in every room. You labor and birth in the same room and then stay postpartum in the same room. And you can get in the shower and tub whenever you want. If you give birth in the tub there, it's whatever. They only have wireless monitors. So a lot of very amazing amenities, I guess I would say, really evidence-based stuff that makes birthing people really comfortable. They all had that. So we were pretty secure going in.
Yeah, our checklist was kind of redundant with their policies in a lot of
Right. It's they were already providing the care that you were interested in having. So it was a good match.
Yeah. And I saw all midwives for my prenatals. I didn't see an OB except for the original, the first ultrasound, and then the anatomy scan. So it's very midwife-led, and the midwives do all the work during birth mostly, unless there's always a doctor, an OB on call, but it's all midwives otherwise. So
And all women.
Mhm.
Except we ended up having a male OB visit us once or twice when he was on.
Yeah.
But he was visiting, taking
He's a traveler.
coverage. He was a traveler. So we had not met him before, but he didn't have any real interventions with us.
Yeah. So then at some point things changed. So can you walk us through how all of that unfolded?
I went in we were going to a lot of the prenatal appointments together, not all of them. But we both went in it was a Friday for a routine prenatal, and I was towards the end of my pregnancy, and I got a high blood pressure reading. And I had actually been kind of worried about preeclampsia or high blood pressure my entire pregnancy. I was monitoring at home because I had some borderline high readings, just like at doctor's appointments before. So it was something I was following a lot of Lily Nichols' advice for diet based on that, trying to avoid as many complications as I could, which was going well. I had like no swelling or anything, but I had a high blood pressure. It was pretty high. It was like 140/90 or something at that first appointment. So they did some monitoring. Everything looked fine with the baby and I.
That wasn't you'd had a couple of appointments where they were marginally high, right? Prior to that?
Like 120 over like maybe 80 or something. So like borderline high.
Okay.
But yeah, this was the first that was like, it was like, whoa.
Clearly abnormal blood pressure. Yeah.
Very much so. I had a great nurse. Her name is Lily. She was awesome. And she was like, she didn't even take it she brought the big machine in. She was like, I could already hear that it was like really something was going on in her, the handheld one that they use. They monitored, everything was fine. I was meeting a new midwife that day that I actually hadn't seen yet. So that was good. And she was like, we'll send you home with a 24-hour urine collection. Because it was the weekend. They were like, you don't need to come back in. We'll see you. Drop it off on Monday. We'll see how it's like, it was going to be, you come back in on Monday and we're going to see, see what we can see and everything. So that was fine. We went home for the weekend. One high reading wasn't like anything super unnerving for anybody. And then I dropped off the urine sample on Monday morning. And then we had another prenatal that afternoon. So I was just in town doing things. And then we went to that appointment together. It was like Monday afternoon. Yeah. And I hadn't checked my chart, like my online thing or anything for any like test updates or anything. So we were kind of going in like, okay, we'll see what my blood pressure is. Like, I was not expecting a diagnosis at the time. And the midwife who came in was immediately like, well, I think it's time, which was like very jarring to hear and a little bit really kind of set me off a little bit because we were doing before she came in, we were doing a lot of like breathing exercises and just trying to keep me like calm before blood pressure reading and everything.
Which was a lot of, like you said, you were doing at home monitoring.
Yeah.
And I think a lot of that.
And nothing was high then.
And nothing was high through the weekend. Nothing was high.
Yeah.
And I mean, for me, I was chalking a lot of it, especially on Friday, up to white coat syndrome, the blood pressure readings, because Paige definitely does get, like, you see it, she gets flushed, she gets anxious when doctor comes into the room and to do blood, especially because you were so worried about it. Like you can tell you were getting, your blood pressure rose when it was time to measure your blood pressure. But I think that was part of why you were doing the at-home stuff, was so that you could kind of know in your mind, like this, I don't have high blood pressure right now. That maybe helped, but by Monday, it was pretty obvious. It was not just blood pressure anymore. Now it was the urine sample.
Yes. Yeah. So I had protein in my urine. So classic preeclampsia. I didn't have any symptoms at all. And like I said, I had no swelling. So it was surprising for sure.
I mean, it sounds like they caught it like, most soon as they could have, right?
Absolutely.
That was the first high blood pressure reading. And
yeah. So they caught it really early. And I was at 38+6 on that Monday. So I was like, we've made it pretty much. So the midwife who I was seeing was like, they sent me over to the birth center to have more monitoring and to talk to the midwife who was on call in the birth center at that time. Because she was like, it's the on-call person's decision of like where to go from here. So we went over and I actually felt a lot calmer in the birth center. So we got hooked up on the wireless monitors. They've got the band and just like the little disc that they put on and everything. And we met a couple of nurses, one who we hadn't met before because she had given us a tour of the birth center. And my blood pressure was normal as I like sat there and everything. So they were like, you have preeclampsia, but there doesn't seem to be any like immediate danger. And we kind of talked to them. It was like, we would really like to go home tonight and come back because I had to run payroll for my farm like that day. And like Kevin had just come from work and
we hadn't worked out what to do with it.
Yeah. I mean, we were like ready for, labor to start at any time, but like also not quite ready.
Right. If you give me 12 hours.
Exactly.
Exactly 12 hours is what we wanted. Yeah.
Yeah. So that was great. So the midwife just checked with the OB on call and she was like, yeah. And then they were saying, oh, you could come back in on Wednesday, like 2 days and everything. But then, so we settled on, I was going to come. They start all inductions at 7 a.m. in the morning, which is nice. That's just a nice thing. So we were
in the middle of the night.
We left. Yeah. It's not midnight or anything like that. I was very disappointed and a little bit angry at first about the diagnosis. It was just like, nobody's happy when something like that happens. And with an induction, I couldn't get intermittent monitoring. And I also couldn't get in the big birth tub as well. So there were some parts of my plan or my preferences that were then off the table, which happens and is disappointing and everything.
Yeah.
The nurses were super great because they were like, you're a healthy person. Your placenta got a little wonky and everything. And they were really reassuring. So it was like hard to have, the diagnosis. But yeah, that's kind of how preeclampsia entered our world.
So you went home and you had that kind of evening and night to wrap your mind around what was happening and get everything ready for the next day.
Exactly.
Yeah. We
packed up some food. We, got Athena I forget exactly how we got Athena.
We dropped her off.
I dropped her off on the way.
That morning. She goes to a doggy daycare and they do boarding as well. So we were able to drop her off. My mom was going to come get her if if I had gone into labor spontaneously. But yeah, we dropped her off that morning. But we packed up. We were like, we're moving into this room. So they have peanut balls and birth balls and lots of other stuff and like diffusers at the birth center. But we brought our birth ball. We brought yoga mat. We brought, tons of clothes. We brought our own food.
Votive candles.
We brought our flameless candles. Yeah, we brought a ton of, I had a ton of electrolytes and everything. So yeah, at 7 a.m., we had gotten a good night's sleep. And then we moved into the room for our induction.
Yeah.
And shift changes happen at 7 a.m. So I guess we'll get into the birth story, right?
Yeah. So what were the decisions you made? What were the conversations about which medications or devices or methods you would use to do the induction?
Yeah. We got all the midwives are awesome, but we got two really good ones the first 2 days who are very it's your decision. They're very willing to go with what we really wanted. So the first morning I was not, so they had done a cervical check and I was maybe starting to open, but not nowhere really there. So the main option was misoprostol. So, and also they use a Cook catheter. I'm just checking my notes. I needed to get, dilate a little bit more for the catheter to go in. So we started with, I took 1 half pill or a pill and then another one 4 hours later or whatever. So I was having we really wanted to go low intervention to start.
Which they tend to as well.
Yes.
Kind of start slow and just get your cervix ready first. Yeah. Okay.
They kind of wanted me to have they do ports, like saline ports. You don't have to get hooked up to anything, but they wanted me to have a port ready. I did not want, just in case something happens with the pill or something. I declined that for the first day because I was like, I really don't want something distracting me.
You didn't have to have a saline lock or an IV in your arm for the first day.
To start things. I was having some crampings and stuff, and it was like, we had taken a spinning babies class towards the end of my pregnancy, which I love and is really helpful, and I totally recommend it to people. So we were doing a lot of the moves from there, and all the nurses there were like very much like, yeah, everybody was like, keep moving and stuff throughout our whole labor and everything. So that was great. And then towards the end of the night, which is when the nursing shift changed, we did the Cook catheter because it was like labor could start with misoprostol, but it didn't for me. So it was clear it wasn't like getting like the whole shebang started. So we chose to get a port put in and the Cook catheter inserted so this was Tuesday, was the first day, in the evening before the nursing shift changed. And the Cook catheter has the two bubbles that they inject with water on either side of your cervix. So that was uncomfortable and stuff.
And you were able to keep moving.
Yeah, you can walk.
Doing like our circuits of spinning babies moves and things like that pretty regularly. So
they just taped it to your leg, the outside of it. So that was the end of the first day. And things started like getting kind of intense with the catheter. I shockingly, but not shockingly to anybody, I was a puker during labor, like throughout the whole time. So I wasn't really surprised because of my experience during pregnancy, but the catheter definitely got things going, and I had to poop and I had to puke, and it was like, all right, things are kind of moving along. So we just kind of kept going through the night, and I think we maybe got a little bit of, I maybe slept like through some of it and everything, but I was kind of sick feeling with
and
that.
Things tough. That's probably my biggest like complaint about the hospital setting was just how difficult sleeping is. Like like the dark, quiet room we sleep in. Typically, there's lights. There's just so many LEDs in a hospital room. Even like a nice calm one, there's just everything's got a blinking light or a green indicator or red indicator, something. And where it is, the parking lot wasn't that far away, so there's pretty nice curtains, but still pretty bright coming in. So sleeping, even if you weren't in labor, I think sleeping would have been kind of tricky in that room.
I don't think anybody wants to go sleep a night in a hospital unless they have to be there for some reason. Do you think having I'm just thinking of people listening, would having an eye mask or earplugs or something like that have been helpful? Maybe if you had to do that again?
Yeah, definitely. And my second midwife was like, oh, you can put we can bring blankets in and you can cover the big monitor station and you can put blankets against the door so the light doesn't come in from outside and stuff. So they were like really willing to okay, what do you need to make this happen? But like an eye mask or something would have definitely helped, I think. Yeah.
So Wednesday morning, what was the update then?
The catheter is supposed to just fall out when you reach 4 centimeters. So it had fallen out Wednesday morning, which had concerned me a little bit. So, but they were like, we take it out after 12 hours, no matter what. Really, I'd gone from 7 to 7. I was glad I had the port because I got a lot of Zofran, intermittently and everything, which is an anti-nausea medication for those people listening. And they just inject it right in, and it was great. But they took out the catheter and they measured me, and I was at 4 centimeters, but it just hadn't fallen out. So that was pretty reassuring because I had been worried, and then I was reassured that I had actually was progressing. Pitocin is usually the next thing, but if you guys want to take some time, go ahead. So we did. They led. I'm going to say it again, but we took off all the monitors and everything. I took a shower. I got kind of a break that next morning, and we just walked around we got to walk outside. We got to like go outside.
So we ran into a friend.
Yeah, we ran into a friend who works there at Porter. And I had brought my like Medela little hand breast pump, and I was pumping to try. I was like, we were doing like spinning baby circuits. We were trying to do everything.
The natural induction techniques that could maybe help possibly move things along.
I don't remember. Was it like every 20 minutes we were doing?
Or half hour,
yeah.
sure.
I mean, it was kind of just something to pass the time.
Yeah.
Something I'm remembering right now is about the EBB class. And with our group that we talked, I remember cervical exams was like a big topic of discussion in our class, and people being like, we're not doing cervical exams. And I would say for me, especially for as long as you were there in labor, they were so important for like signposting and just like, okay, progress is being made. If we weren't doing that, if I wasn't getting at least like every 12 hour, like you are still progressing, after 30 some hours, I would out of my mind, I think. So that was like, knowing that like by Wednesday morning we were at 4 centimeters, that was important.
Yeah, you have to fight really hard for those first, 4 centimeters when you're being induced and you were not, dilated at all at the start. So it's hard work for sure. So it sounds like you got to reward yourselves a little bit. Go on a walk, take a break, take the monitors off before you kind of started the next phase.
Yeah, That was really nice. It just a little refreshing. Stay hydrated and probably have some breakfast. At that point, I was probably feeling up to eating at that point in time. Yeah, and then around probably 10:38, we had a midwife change because they do 24-hour shifts and then the nurses do 12-hour shifts. So we got a new midwife who I had seen quite a few times during prenatals, and she's really sweet. So at like 10:30, we were like, well, we'll start Pitocin. It's fine. So it seems necessary. So they start super low and slow. They start at 1 micro unit or whatever it's called. And then they increase by 1 or 2, depending on how we feel, every 20 to 30 minutes. So I think the most I was at any time was 14 over like my whole labor. So
it took hours to get up to that.
Super low and slow. So we knew we were in good hands starting Pitocin. The really annoying thing was that I have now an IV tree that follows me around. So that was the big downside of that. So, but again, I have like this rolling thing that I can walk around. I'm not in a bed or anything.
You're still mobile. Yeah.
So we were still I was bouncing on the ball. At one point, this was later in the night, but they let me get in the tub with it and everything. So, I mean, they were amazing. But yeah, we just went through the day. Contractions started and we're picking up and everything. So that was Wednesday, the second day. And at 5 p.m. on Wednesday, my water broke by itself in a very spectacular fashion. I mean, we were lying in bed, like watching TV or something. And I felt it burst. And I was like, oh my God, my water just broke. And it was like everywhere. And it was like very like TV movie kind of like
that amount of fluid. Yeah.
That was great. I remember my nurse saying, oh, that's great. Because then they don't have to do it. Like, it's great that your water did it on itself. And I was like, okay. Because things really started to get intense after that because there's less cushion. So I was at like 5 or 6 centimeters at that point in time. So Wednesday night, and my water had broken. So that we were entering the second night. Again, lots of Zofran. And at a certain point in time, like the next day, they started giving me Reglan, which is a stronger anti-nausea medication. And at that point, I pretty much couldn't eat much, but they were still offering popsicles and saltines and like lots of water and everything like that. So that night was really intense.
Sorry to get really intense.
Yeah, Kevin, I want to ask Kevin, this might be a good point to ask you. So like what comfort measures were you helping Paige with kind of during the Pitocin phase as opposed to like then after her water broke? Can you walk us through like what seemed to help the most before and after her membranes ruptured?
Okay. Yeah. Can I? Well, yeah. So there's a lot of counterpressure. So do you remember what the cycle of the spinning babies? I don't remember the exact exercises.
There's the sideline release is the one where I'm like kind of hanging off the bed. And then stuff on the floor.
Jiggling. Side
The jiggling.
Yeah, that one. Just like doing that, but then also kind of, jiggling that goes along with that. You on the floor, the Dana's one. Just getting you to go through those, I think, was also just kind of being like let's do that. Let's get up and go through those.
Movement in different positions.
Exactly. I think, through those, you always seemed to be in better shape after going through one of those cycles. And so, those spinning babies things were huge. From like a water popsicles, they have a little cantina outside. So popping in and out for those kinds of
you were doing that.
Treats, was important. And also you drank insane amounts of water, I think. Yeah, like the amount of water we have that, like they give you a cup, the like 1 liter
cup, yeah.
Wow.
And I
Classic.
like, I don't know how many gallons of water you drank each day, but it was a lot. So keeping that filled, making sure you weren't worried about that. And I think those were my main bag of tricks.
I like the counterpressure a lot. Mm-hmm. And that became more important as I was started. Having more intense pain.
Yeah. And a lot of that is just like, it doesn't feel like you're doing much as the person doing that. The counterpressure, especially, it like does not, you're not putting a lot of pressure down, but you just kind of tell your partner actually is responding to it. So you just have to trust that.
You're talking about counterpressure on the sacrum?
Yeah.
Okay.
Yeah, specifically, And you did some hip squeezers too. The hip squeezers were less. The counterpressure on the bottom of my back, really.
That was really effective.
Towards midnight that night, after just doing a lot of this stuff, I felt like I needed something a little extra. So that's when I got in the tub. They just kind of saran wrap your IV in your arm, and then you just have to kind of keep it out of the tub.
That was something you thought you might not be able to do, but you were able to get in the tub.
Yeah.
Induced. Okay.
That was really great.
We're tub, yes.
Oh yeah, birth tub, no, but the shower tub that they have in every room in the bathroom I could get into. So not the big birth tub, but
I don't know what the difference is, but
yeah. Because I love water and I love swimming and just like water. I take baths all the time, so I thought that would help a lot. But at one point, I was just in the tub. I was at 7 centimeters at the point in time, and it was after midnight, and I was really tired, and I was in some pain. And so at that point, nauseous. At that point, I had our nurse call and wake up the midwife because I was I need something a little bit. I wanted pain medication at that point in time.
Yeah, there was about an hour and a half of you being, I would say, exceptionally uncomfortable and in pain, legit pain, uncomfortable, in the tub, exhausted, getting progressively more exhausted over that period too.
Yeah. The pain wasn't so much my issue. It was I became afraid that I would be too tired to push when the time came. That was actually my main concern was how tired I was. Cause we're at hour 36 or something at this point in time. Mm-hmm. So I asked her, I was can I get an epidural now? And she was well, there's some things that we could do before an epidural that might help, some pain options. So I was okay, sure. Least invasive thing first. So we tried Nubain, which was, Kevin can describe the experience more because
it didn't work for him. I would say it did not work.
I would describe the experience as I passed out for an hour, but woke up every time a contraction happened, basically, in lots of pain.
Which was every 4 to 5 minutes at this point.
I think it was 2 or 3 minutes.
Yeah, it was rapid. And it was, at that point you're on. It's dealing with someone on narcotics. I can't. The ability to kind of reason, you were already kind of loopy prior to that because of just exhaustion. And then it's just I can't talk to you anymore. There's really no communication. You're supposed to be sleeping at that point, but you're waking up every, let's say, 2 to 3 minutes in pain. And you just, as a partner, you don't feel there's any comfort to provide because there's no reciprocity with giving affirmations or anything like that. It's just scary, kind of.
Yeah. You kept on the counterpressure, which is the most important thing.
Yeah, no, you keep doing it, but it's just like, there's no, the thing, like I said about the counterpressure, you kind of have to, so you like go by your partner's reactions back, and it's like, you lose that with that. I lost that with the Nubain.
I've heard people have good experiences with it, so I don't want to scare anybody off of that.
Everybody reacts differently, and I, you do hear that sometimes it decreases your level of consciousness, basically sedates you, but you can still feel the pain just as much in your situation. Yeah,
and you can't take it back. It did feel kind of like, I mean, it's like that night where you've had one too many drinks, and you're like, man, I wish I had. And but it's like, yeah, you can't take it back once you.
You just have to let it wear off, and
you gotta let it go for a while. Yeah. So we knew, there's a light at the end of the tunnel with that. And it was hard for me to believe that you were getting much rest, but it did seem, once we got through that, I think it was
an hour.
An hour of that being really tough. You did seem refreshed, surprisingly.
Yeah. 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 The midwife said you get 1 to 3 hours and she told us everybody reacts differently. So, we could try it and see. And we tried it. And it was interesting. But after that, I did ask for an epidural at that point in time. And I got it. So it was 1:30 in the morning. I guess in my mind in the beginning in pregnancy, I was really not planning on having an epidural. I really did want to go unmedicated, but having an induction kind of already reaches you're already very medicated. And I've never had a birth without Pitocin, but it seemed, pretty intense and everything. So I was glad to be there and have the option for an epidural at that point in time. I really wanted to sleep and kind of get some rest and everything. So, I signed a consent form and it went in no problem. They placed it no problem and it started working right away. And right away, probably in 15 minutes or something. And I remember telling Kevin, I was like, I'm so happy right now after it started working. So that was great. Yeah. Getting the epidural. And then I slept it was probably, it took a little time to get placed. And then I just I slept completely for probably 5 hours. They do shift change at 7 a.m. So I think they woke us up for shift change. And they turned the Pitocin off as well when I got the epidural. So they just kind of I was just
give you a break.
Got a break, had the epidural, got a bunch of rest. And so that was really, really nice because the next morning was Thursday morning. And I also wanted to mention this entire time, my blood pressure was totally normal. They had to check me every hour because of my diagnosis, but I only had one high reading, and that was after a shift change or something. So I just want to mention there wasn't any there was no chance they needed to put me on magnesium or anything. It was things were non-urgent in really any way. So that was great. And I think they just generally, we're given the time to let my body do its thing and work through the motions and everything. And never felt rushed or anything during the whole period, which was great. And also ironic that I had normal BP the whole time. But the next morning was, shift change. There's a family doctor who does rotations with the midwives. So she was on next, and we actually hadn't met her during prenatals, but we had met her at a party the summer before, just because it's a small town and everything. So we had run into her before, which is really funny. But that's Renee. We love her. She was the next birth attendant on rotation, and they put me back on Pitocin. I was at a 9 or something that morning, and they put me back on Pitocin that morning after breakfast or whatever I could get down and stuff. At some point that morning, I was at a 10, and I was at a +1 station and 10 centimeters around 11:15 a.m. on Thursday. I have my notes here.
Yes.
I've written everything down.
And I was going to ask Kevin, did you get a chance to sleep then once the epidural kicked in as well?
Yeah.
Okay.
I think I got a good 5 hours of sleep each night.
Mm-hmm.
Yeah, because you were, while I was on Nubain, you were like very like, you were reading middle March. That's really
little by little, but no.
But you didn't get a lot of rest when I was on Nubain. But then you got to totally conk out when I was on heavy epidural, which was
for the most part. You're still kind of like, on pins and needles. It's not the most restful sleep, but
as I stated, at like 11 in the morning. It was like time to go, basically. They were like, it's time to do the thing. And I was really hoping to like labor down a little bit and stuff. But one of my nurses was like, as a first time mom, you might need to push to get, things going. So we did coach pushing, which was not my favorite, but it's probably nobody's favorite. But they had like a little, at 11:15, it was like, okay, it's time like to push. And I was in bed at this, like after the epidural gets placed, you have to stay in bed. And we had been doing a lot of like position changes that morning and everything, like after I woke up and stuff, different stuff with the peanut ball and everything. But then they had their little like get together before pushing. There was like a bunch of other people who came into the room, not like a bunch, but like other nurses.
A little huddle of people.
Yeah, exactly. Like, a little pep talk and everything, which was funny to overhear.
Including a student.
Yeah. I don't know if they came in then or
I don't know if they came in then. I would, okay. Yeah.
We'll get
someone visiting.
Which I consented to. It's just, I don't really remember consenting to because I was like, really, it was in the middle of pushing and everything. But
it seemed like something you would have consented to. So I didn't raise any issues.
Yeah. So I started pushing around 11:30. I was switching up between both sides. And then also I did some hands and knees. So I had originally thought hands and knees would be really great, like thinking about birth. And then it was really exhausting for me, actually. So on my side was actually the most comfortable position to push in. And we flipped sides whenever I got like tired of one side, and we got all the cords like flipped around and everything.
Yeah.
And
probably every like half hour or so.
Yeah. Our son actually started crowning like after half an hour, like really early. And Kevin got really excited.
I jumped the gun.
Yeah.
On like stating like, all right, like we're there.
You're like, I can see the head, but then it kept taking time then. Okay.
Yeah.
And he just gave the stop.
Yeah. Another thing my provider did was she used, I think it's arnica oil. They do a compress on your perineum. So she was doing that, and that was great. Because I didn't have, we'll get to it. But it was 2 hours and 45 minutes of pushing. My birth attendant said that he was in a great position. Mm-hmm. Like we had an ultrasound like before, and he wasn't sunny side up or anything. So I didn't have any back labor during the point. But he had his hand near his face or something, so it made him a little bit cockeyed. So she was like, that's probably why it ended up taking so long. But otherwise, like it was pretty straightforward of a actual birth. And I felt his head a couple times. Like, that was really hard. But at that point in time, I was like, I can do this.
And everybody seemed to be, it's just going to take as long as it takes. There was never any sense of urgency around that. Apart from,
I think you're getting close to the finish line, but people weren't panicked. There's no urgency. There was no panic.
Right.
They were just
I don't know how much of that was just any kind of poker face or anything, but they did a great job of just kind of keeping at the same pace the whole time through there.
Yeah. Telling me to push everything.
Everything. And I was there that, just kind of lifting legs, helping with those flips. Yeah.
Yeah. And at that point in time, also my left leg was very numb. Which was super uncomfortable. And we can get into that postpartum, but I did end up having nerve damage, probably from my epidural. But it had fallen asleep basically. So my entire pushing phase, my left leg had fallen asleep, which was annoying, but somebody just had to hold it up kind of. And it just felt really fuzzy and everything. But it was a lot of pushing. And at a certain point, I was like, my body was starting to like be like taking up, like I felt like an intense pressure to push like towards the end and everything. And then I pushed him out and he was born. Mm-hmm. And we didn't know the sex beforehand. So Kevin got to announce that. And I cut the cord, but they wait like until it's white like they do delayed cord clamping pretty much as a default there as well. So they clamped it after a while, and then I cut the cord. Yeah, it was, I don't know. Yeah, it was birth. It was amazing. It was like, you're here. And everything was fine. No, I don't know what his APGAR score was, but like no distress. And they do, we get like 2 hours of skin to skin, like no question, like just that's automatically what they do anyway. So yeah. And I didn't have no tearing, like a small, like first degree internal laceration, but I had an intact perineum leaving that, which was amazing. But yeah, and then, Ira was here in the world.
How did it feel after that marathon of an experience to like you didn't know you were going to have a son, hold him on your chest?
It was really good. There's like a very, very specific high after birth. Like I felt like I could run a marathon like in the first couple hours after birth because of all the adrenaline or hormones or whatever is happening and everything. So it was like very much like I was buzzing quite a bit. And it was really nice. And we got to, it was lovely to have time to just hang out. And I wanted to breastfeed. So he did latch like pretty soon after. We just kind of like let him do his thing on my chest, which was nice.
He was very sleepy.
Yeah, he was very sleepy.
He was really sleepy for the first day or day and a half. Mm-hmm. So breastfeeding he did latch, but then we kind of had a lot of coaxing involved for the next sessions of breastfeeding. Like the first one seemed easier than like the second or the third. Yeah. So a lot of, like rubbing cheeks, playing with his feet, things like that to kind of coax him into that.
But it was really nice because we got to just stay in the same room. So it was just like, it was very relaxing post-birth. It was like,
the only people there for a good time. By then there were other birthing mothers coming in, but we had been the only people in the hall of like 5 rooms. Yeah, we were the only ones for quite a while. Yeah,
they have 4 like L&D rooms and then 2 small ones if they need to like spill over into there. So everybody was very focused on us. So that was really nice. But the marathon was over at that point in time. Mm-hmm. But then we were still at the hospital for like 2 days.
And then you entered postpartum. So what was recovery like for you physically and emotionally after this birth?
Yeah. We stayed 2 nights after. I was enjoying the kind of people around and like kind of having our needs taken care of and everything. And they also found there was like a lot of wonky stuff that kind of happened after birth. They kept me on Pitocin for 2 hours after birth because I was induced and the risk for hemorrhage. So everything went fine. My placenta was birthed very easily and everything. Yeah, we did a lot of the like after birth stuff for Ira, like vitamin K and everything. Mm-hmm. And then in one of the fundal checks, they found this like kind of hard mass, which ended up being a fibroid that had grown a lot during pregnancy. So it was the pregnancy hormones just like kind of made it really big. And my midwife was like, what's this? So I had to get like an ultrasound after just to check its size and everything. And it's since shrunk. So that was like kind of a weird thing that happened. And they wanted to monitor me because of preeclampsia just in case. So we stayed and it was nice. We got food and showers and all that stuff. But my leg was still asleep. So I was kind of like, I think it's maybe normal for 24 hours after your epidural comes out for your leg to still be asleep. So I was having a really hard, my foot was mostly asleep. So like, it was like, I couldn't lift my toes up. Like they were kind of just like dangling like that. So that
just was part of life for like 3 months.
Yeah. Well, yeah. So breastfeeding sort of took off a little bit. I was really committed to that, which I think is what made a difference. We just like kept trying and trying and trying. So we got to go home on Saturday morning.
Yeah.
And my leg was still asleep. So, and I didn't say it explicitly to anybody, but I got wheeled out of the birthing center.
Default, yeah.
because I couldn't walk very well. I could walk, but it was like really difficult. And gosh.
Just bring it up on our way out. Because I do recall, like, we stopped short of leaving and we brought up your leg.
That was at the one.
Was that the 1 week check? Okay.
No, the one day. So our birthing center so we went home, adjusted to life with baby, all pretty like standard stuff. And then they do a 24-hour newborn check. So we brought him back there and they do like, it's just something they offer. You come back and they weigh him and check his bilirubin and like, all that stuff and everything. And then at that point in time, I was like, hey, to the nurse, is this my leg is still asleep from the epidural. I assumed it was from the epidural at that point in time because it happened concurrently. And she was like, oh, I've never heard of that happening, which is not what you want to hear. It's a weird thing. But she talked to the anesthesiologist and they ended up calling me back on our way home. And that was my biggest postpartum complication was I had nerve damage. So on the phone with one of the nurses, it was like, it can happen if you're pushing for a long time. But I had felt it before I started pushing. And it is a complication or a side effect sometimes of epidurals. So nobody explicitly told me it was nerve damage. They were just like, this sometimes happens and you can go to like chiropractor or physical therapy, but it will eventually resolve on its own, which was all a little bit of a scary timeline for me because I'm a farmer and I just didn't know when it was going to resolve and everything. So during postpartum, that was my hardest challenge. And it maybe was actually a good thing, not a good thing, but like I took it really easy postpartum because I couldn't really walk.
Okay, so you didn't jump right back into farming, right?
Yeah.
You didn't.
No, I was.
To be fair, it was also November, so there's not much farming.
Yeah.
Okay.
We should mention, yes. So we were lucky enough to be able to kind of plan our pregnancy, and November was a perfect time to give birth because I have the whole winter to recover and everything. Mm-hmm. So that was really great. I was just afraid I was going to trip and drop our baby at some time. So it was kind of intense and a little freaky, but I did a lot of acupuncture and massage therapy, and I also see a craniosacral therapist. Those are all people that I've like seen in my like pre-pregnancy life, and those all really helped.
Yeah.
And it got better after 3 months. I was able to I was pretty much like 90% better at the 3-month mark postpartum. So I remember you had a podcast last summer with someone who also had nerve damage, and I think her recovery period was much longer than mine. So I feel pretty lucky that I think hers was at a year. It was still kind of funny feeling, but that resolved itself, which was so great.
It was probably about 4 weeks where for the first 4 weeks, there was like no emotion. And then after that, about 4 weeks, there was like the tiniest glimmer of toes moving. And it was just nice to be able to see like a signpost. Okay, this is going the right direction. So like they tell us it's going to get better and there's a sign that it's actually getting better. And that was good to see. And for me, at least, took a little stress away because I was also, it is scary to think you're going to have a lower mobility. I mean, it wasn't keeping you from moving, but it definitely lowered your mobility quite a lot.
I couldn't go.
I believe it's called foot drop when you can't lift your toes up on a foot. And it's a rare but serious complication. So it's the kind of thing that like when they do large studies of epidurals with birth, they don't hardly ever see it. That's why one of the reasons they say epidurals are so safe. But epidurals in general are used, in a lot of the population for different surgeries and things. And there have been cases reported post-epidural of that foot drop damage. Yeah.
It's good to have a name for it.
Yeah.
And to, not hear that I'm alone. Because it was, nobody explicitly said anything. So It was kind of, it was like.
And you said how many months afterwards did you feel like it was totally resolved?
It was 3 months. Yeah.
3 months.
So relatively quickly, I felt.
Okay.
Yeah.
But still, it can be scary because you're like, is this ever going to go away? Is this permanent damage?
Yeah, was exactly what was running through my head a lot of the time. So, yeah.
Mm-hmm.
Yeah. But yeah, Kevin was home Kevin got 6 weeks off during postpartum. And then after that, he went back to work kind of part-time very slowly. So,
6 weeks plus because of the holidays right around then. So that was, got to kind of spread out that time.
Yeah, so we had a lot of support. I have family. I grew up around here, and our neighbor set up a meal train for us and everything.
Mm-hmm.
So we had a lot of support postpartum. It's great, especially because of that.
Mm-hmm. So Paige and Kevin, you went through a lot with this birthing experience. I just want to honor that and also give you just compliments on how well you stuck together as a team. And I know, Kevin, the nurses had a name for you, right?
Well,
Yeah.
It's the doula. That's
The doula.
I don't think that's
gender.
I think the first one they've applied that to.
Yeah,
but
54 hours of labor support is no joke. So, and Paige, obviously for you were the one experiencing it. Since you went through all of this together, do you have any words of advice for our listeners who might be planning on entering birth or parenthood soon?
Yeah, we tried to look for a doula, but couldn't find one because there's there's
You're in a rural area.
And a lot of them were taking time off or having their own babies that year. So Kevin really stepped into it. You were happy being the only person, the support person for me though. So
ultimately, I think I was. Yeah. I not that it would have felt. I think it was. Yeah, it was nice to be the primary person.
Mm-hmm.
I had the time.
You probably could have used some backup if you had available.
Could have. Yeah. But it was. Yeah, it was kind of like it would have been. Yes, it would have been tough to maybe share that responsibility or trade off. And I would have probably been getting in their way, honestly. You would have been. Yeah.
You like to feel useful.
Yeah.
So.
Yeah. So, I think, there's a lot to be done. I think the spinning babies was so the analogy, I was probably sick of it, but the analogy I kept using is during the EBB class too, is it's like going into a boxing match where you're going to have set periods of really intense something to do, and then you have a little rest period, but knowing what you're going to do during that, or interval training where you're going to having something to do if you just send someone out and say, all right, go do a workout. Well, what am I supposed to do? But you're okay, go do 10 push-ups, go do some foot sit-ups, having the exercises to do, which we gained, the spinning babies was probably where we got that from, was really, really useful to then be able to use that as a rhythm and kind of mark.
You had a lot of tools in your toolkit.
Yeah. And mark, you can mark that time because again, depending on how long it is, it's a lot of time to fill.
For us,
that was a lot of time. And it would have been, if there was boredom had set in, there's boredom never set in. But if I could imagine how it would feel even more interminable or just less pleasant if you didn't have those things to go to. So have a plan for every 20 minutes. I'm going to, a little alarm's going to go off and I'm going to go through my checklist of, okay, have I done this? Have I filled the water? Have I done this? Have I done that? Have those ready to go would be my advice to a partner who is going to be doing.
Yeah. You were integral to the process. So yeah, for birth, that was really important. Yeah. And then for, I just wanted to really plug or give some people advice on postpartum period specifically. Mm-hmm. I was actually more worried about postpartum than birth, honestly, because it's just such a big thing to recover from. Excuse me. And something that made our postpartum much easier, and it's kind of a taboo topic in North America, and it's really stigmatized, but it's a cultural norm in a lot of the rest of the world, is intentional bed sharing. And we actually both read Dr. James McKenna's Safe Infant Sleep During Pregnancy, which was really great to do at that point in time because it set us up really well. And I would advise, I think there are criteria and also guidelines for bed sharing. And we met them and also set things up as safe as we could to mitigate risk. And even if parents or expecting parents aren't planning on co-sleeping or bed sharing, I think it's really important to read up on how to mitigate risk because you never know if your baby's going to be a baby that doesn't sleep solo, won't sleep in a crib or bassinet. And you really want to avoid unintentional or accidental bed sharing because that's really dangerous and risky. And so is sleep deprivation if you're just holding your baby all the time. So there's lots of good resources. Like I mentioned, Safe Infant Sleep. Dr. James McKenna runs research on breastfeeding, mother-baby sleeping dyads, has done for like decades. And there's Helen Ball's How Babies Sleep. That's a new book. That one was really good. And then La Leche League has the Safe Sleep 7. And there's a couple of Instagram accounts, Co-Sleepy and Safe Co-Sleepers. And they do a lot of talk about safety and just mitigation. Like not everybody can, because there's reasons why it could be unsafe that are out of your control and everything. But I think it's just important to know. And nobody gives you any information at the hospital about it, because they give you one,
or at the pediatricians or anywhere.
Exactly. Yeah. There's like one thing we're supposed to do, and everybody really wants to do that. But for some people, it's like everybody commented on how well rested we looked during postpartum. And I'm still breastfeeding at 16 months postpartum, and my goal is 2 years. And I really think it contributed to that, because those nightly frequent feeds really helped me build supply and maintain it over the earlier months and everything. So,
or having to walk across the room or walk to a different room.
Exactly.
Every time you needed to. Yeah.
So that's one of my advice is just to try to find some research on that and everything and educate yourself. So
we'll make sure to share the links to some of those resources in the comments. I know in the EBB Childbirth Class, we linked to Dr. McKenna's website where he has all the research and I think really good common sense safety topics that he covers with cartoon images and graphics that help you understand the safety issues. So
absolutely. Yeah. It's great.
Paige and Kevin, thanks again for coming on the podcast and sharing your awesome birth story. And I'm so happy that everything turned out well for you and that you have baby Ira at home and Athena and that you've got your family going strong.
Thank you very much.
Thank you. Thank you for having us.
This podcast episode was brought to you by the book Babies Are Not Pizzas. They're Born, Not Delivered. Babies Are Not Pizzas is a memoir that tells the story of how I navigated a broken healthcare system and uncovered how I could still receive evidence-based care. In this book, you'll learn about the history of childbirth and midwifery, the evidence on a variety of birth topics, and how we can prevent preventable trauma in childbirth. Babies Are Not Pizzas is available on Amazon as a Kindle, paperback, hardcover, and Audible book. Get your copy today and make sure to email me after you read it to let me know your thoughts.